Good day and welcome to S.O.S. And if you didn't know, S.O.S stands for Soul Filling Our Sisters. This amazing programming is brought to you by blackdoctor.org in conjunction with Touch for Life. And I am the moderator and the host for this discussion for the hour. My name is Dr. Monique Gary. I am a breast surgical oncologist, and I'm part of the medical advisory team for Touch for Life. It is my extreme pleasure to welcome you all and to bring to you some issues and some conversations that we need to be having in the Black community. Because as we fill our souls and as we talk about the importance of self-care not being selfish, well, guess what? It's open enrollment season. And we got to talk about what are we doing? What decisions are we making with our healthcare coverage that could be impacting our healthcare, our screening, our prevention? And so today's program, whether you have a diagnosis of cancer, whether you know somebody who's going through that journey, or whether you're just like, I don't know what my deductible is, and I don't know what plan to choose, and I don't really understand the business of health insurance. We're light today on this really key topic for you because you know what? Insurance is one of those things you don't know that you need it until you need it. And so we want you to know what to do, how to make smart decisions, how to use that plan to maximize your wellness, not just illness, but in preventive and well care as well. So it is my sincere pleasure to set the stage and we're just going to talk about it. So here we go. Get ready. Bring your questions, put them in the chat because we're talking all things navigating insurance in the BIPOC breast cancer community. Let's do it. Our panelists today, Dr. Maya Roberson, Monica Bryant, and Laura Crandon, will be joining us in succession. Our panelists today, Laura Crandon, Dr. Maya Roberson, and session, and we're going to have a jam-packed conversation. But I want to bring first the CEO for Touch for Life because we need to talk about why this topic is even important and how it relates to people who are going through their breast cancer journey. So we're going to bring on Laura Crandon. Laura is the CEO for Touch for Life, and we're going to talk about her journey and why this topic for today for you. Laura, welcome.
Hi, thank you so much, Dr. Mo. It's really a pleasure to be here.
It's good to see you again. Good to see that smiling face. So, all right, Laura, we know each other. We go way, way back, right? We're in there. But for people who are watching and don't know you and don't know your mission, can you give us a little bit of an overview of Touch for Life, why you started it, and talk a little bit about the importance of S.O.S. What are we here for today?
Sure, we go back like spinal cords and rocking chairs. We started S.O.S, Soul Filling Our Sisters, because we were hearing Black women say, I'm overwhelmed and exhausted. And there's information that we don't know. So Touch for Life, just to start off, is really focused on breast health equity. That's what we're committed to because of the disparities that exist. So our mission is to increase the breast health IQ of our population, so the Black and Brown community, as well as underserved communities in general. And we really want to eliminate the breast cancer outcomes disparities that exist for us. One day we want to have a world where, first of all, breast cancer doesn't exist, and then make sure that's the case for everyone. And S.O.S is really a platform for us, by us. It's an opportunity for us to kind of make girlfriends meet the view. So we bring on experts and we bring on people with lived experience to really talk about important topics. And this, of course, is part of our 7-part series of Black Genes Matter. And we're talking about insurance. I spent 15 years in the health insurance industry as an executive. And I know how important that is in making decisions about care, access to care, treatment, and even physicians thinking about, I'm sure you know, the implications of insurance and coverage particularly on a breast cancer journey.
Laura, I got to ask you because we know some of these statistics surrounding breast cancer, but you mentioned disparities. Can you give us a couple of those striking disparities if you're, aware of them? What are we talking about here? What's different?
Yeah, I mean, these gaps are really material that really make a difference in outcomes. So, Black women are 41% more likely to die from breast cancer than our white sisters. Um, we're also more likely to get the more aggressive form of breast cancer, triple negative, under the age of 35 at a higher rate and die of that at a higher rate. The other disparity or gap that we're seeing is in the testing, genetic testing and what's called biomarker testing, that both help screen and identify your risk for breast cancer, but also if you have a diagnosis, those tests help guide your treatment so you get personalized care and that you get to be more eligible for the more advanced treatment in cancer. And so those gaps persist in across our community in ways that really are unacceptable, which is why I started Touch for Life.
Wow. And that is really moving because when I hear things like, 40% increased mortality, Black women under the age of 35 are diagnosed, at twice the rate and die at three times the rate of their white counterparts. Those numbers are really sad. And when you're young and you're under 35, you're under 40 at any age, you think that health is kind of a given. You feel well, right? So you must be well. But what happens when illness strikes? And, I really want to talk about how does understanding insurance align with Touch for Life's broader goal? Of all the things to tackle, we're talking about Black genes, we're talking about cancer treatment and research. Why insurance?
Well, I think about insurance coverage is really like public health because, it really does impact a large portion of the population. And what we've also seen is there's a direct correlation direct connection between insurance coverage and screening rates. Those states that have opened up the screening and lowered the cost and the barriers see higher screening rates. That means cancer gets to be detected early when it's most curable. It also, insurance, you think about in health, the financial implication of whether you have to pay out of pocket for a mammogram or pay out of pocket for an MRI or an ultrasound might mean the difference between you eating and getting that exam and paying for that exam, or a medication and getting that screening, which means the cancer might be found later. These are real life decisions. And so understanding what's covered and getting those rates up, that's really important to us at Touch for Life. And because it's the season, open enrollment, folks are picking their health insurance plans. It's important to have the information right now while you're making those decisions so you can pick the best plan for you and ask some questions about what's covered and what's not, because it really can make the difference between detection and not.
Wow, I love that you are bringing this thing home because the studies show that one of the number one reasons why, especially Black women, are less likely to complete all of the therapies for their cancer care is cost. It is cost. And so we have to talk about this as we talk about health equity. The major barrier to health equity includes things like access to care and access to screening. But underlying that is, yeah, you have an imaging center in your community, but everybody's worried about the cost. And so it's important to know what's covered, what's not covered, what should be covered, how to advocate for yourself. Because again, you don't want to wait until you need it to find out that you didn't have the right plan or that you didn't get everything that you deserve. And so, as we talk about health equity, we have to have that conversation about insurance. So, we're going to get into it a little bit more. And I want everybody to really stay tuned as we talk about the basics of insurance. So, what questions do you have? put them in the chat. And in the next segment, we are really going to get into the basics of health insurance. Get ready. As we come back, I want to introduce to some and reintroduce to others Dr. Maya Roberson. Dr. Maya Roberson is a friend to the show, and she has some really interesting research in epidemiology and population studies and issues surrounding the healthcare disparities for Black women and breast cancer. So, Dr. Maya, we want you to come on board and welcome. Welcome back to S.O.S. Filling our souls, filling our sisters.
Great to be back, Dr. Mo. Thank you so much. I am an assistant professor at the University of North Carolina, Chapel Hill, in the Department of Health Policy and Management, and I am a cancer care delivery researcher, and I just want to see Black folks get better cancer care. That is my main goal in life, and so I'm so thrilled to be here today to be talking about this important topic of health insurance in Black and Brown communities.
You know, I knew you were a badass, but I didn't know that you knew so much about this topic because this is a topic that is very uncomfortable for people. You know, so we got to talk about health insurance a little bit. And we do want your questions in the chat. But what are some of the essential elements and aspects of health insurance that breast cancer patients, especially, should understand?
Right. So, one of the things that trips a lot of people up is all of the terms in health insurance. There are so many different things. And so let's break it down a little bit. So there is, regardless of what type of health insurance you have, there is the premium. And the premium is what you pay every month. This either comes out of your paycheck if you have health insurance through your employer, or maybe you pay someone, an insurance company directly per month. This is the monthly cost of having health insurance. And if maybe you don't have health insurance through your employer, but you're under the age of 65, there's a health insurance marketplace through healthcare.gov. Each state in the United States runs an insurance exchange, as they call it. Your healthcare costs can depend on your geography, where you live, whether you smoke or not, your age, and whether you're trying to insure just yourself or your family. And so on a place like healthcare.gov, where they have a lot of these terms defined as well, if you have certain income levels, you may qualify for subsidies to get some help with these premiums if you don't get your insurance through an employer. So that premium is what you pay per month. Next, if you're scrolling through, as was noted, it's open enrollment season. I just got my email today. I have TRICARE, and it's like pick a TRICARE plan. Some of the other terms that you might see on kind of that initial page as you're trying to weigh your options between different plans, besides the premium, what you'll pay per month, is the deductible. And so the deductible is how much you pay before your health insurance kicks in. And so, in general, a rule of thumb is that the lower the deductible, the more comprehensive the insurance, because that means that you don't have to pay very much for your insurance to kick in. Your premiums might be a little bit higher because you might be expecting to use some more healthcare. In contrast, if you say, I don't think I'll use insurance, but you never know, I will say, there are things called high deductible health plans. These health plans have much higher deductibles, lower premiums, but that means that you might have to pay $10,000 out of pocket before your insurance kicks in. And so there are very important distinctions. So for me, my deductible is $1,000. And so that means that my family pays $1,000 out of pocket per calendar year before our health insurance kicks in. But you don't necessarily have to pay for everything out of pocket. Because of the Affordable Care Act that was passed over a decade ago now, there are certain preventive health services that must be covered by all insurance plans, regardless of insurance type, regardless of whether you have a plan through your employer, you got a plan on healthcare.gov, if you have Medicare, or if you're on Medicaid. There are these essential preventive services that must be covered with no out-of-pocket costs for individuals. These sorts of factors include things like immunization, so your flu shot, your COVID vaccination as well, any sort of vaccines that you'd be eligible for. They include things like contraceptives, birth control options, reproductive health care, well woman visit per year. Importantly, they also include recommended cancer screenings for your age. So, talking about breast cancer, we're talking about mammograms. So, this means that regardless of what insurance you have, whether you have a high deductible plan or you have a low deductible plan, you will be covered for a mammogram if you fall within screening guidelines. And that part isn't necessarily as well advertised, and it's something to keep in the back of your mind. And then, lastly, I think one of the important factors too is something called the out of pocket maximum. And the out of pocket maximum is the maximum amount of money that you would pay per calendar year if you really utilize a lot of healthcare. So, for example, the out-of-pocket maximum might be on healthcare marketplace plans. It's around $9,500 for an individual, and so $9,500 is the maximum amount of money that a person would have to pay, and then all of their services beyond that are covered. Just a couple of other quick terms. A copay is a fixed amount of costs that you might pay to utilize a service. So if I decide to go and see a specialist, I might pay $20 out of pocket. That $20 never changes. You might have a fixed cost for an urgent care visit or an emergency department visit. This differs from a coinsurance, which is another term you'll see. A coinsurance is a percentage of a cost. Most frequently cost more. And so, for example, if you have $1,000 healthcare cost and your coinsurance is 20%, that means that you have to pay $200 out of pocket, even if you've met your deductible. And so that's something that's important to keep in mind as you're weighing your options, thinking about copay, coinsurance, and all of these factors.
So wait. So even though you pay your deductible, even though you paid your copay, there's still this co-insurance. And say that one more time for the people like me who maybe don't know as much about insurance as we should. What's the difference between the copay what's the difference between the deductible and the co-insurance?
Sure. So the deductible is I know this stuff is so confusing. The deductible is the amount that you have to pay before your insurance kicks in if you're utilizing services for anything other than those kind of preventive healthcare services that are automatically covered regardless. A co-insurance means that you, regardless of if you've hit your deductible or not, usually if you've already hit your deductible, but you still haven't hit your out-of-pocket maximum that I was mentioning, so you haven't hit that absolute cap of what the insurance company says that you can pay per year, then you still have to pay a percentage of the service that you are receiving until you hit that out-of-pocket maximum, which many people do not. And so that's something to keep in mind if you're choosing between a plan that has co-insurance versus co-pays, because a co-pay is usually a fixed cost for that visit. It might be $20 for a primary care visit, $50 for a specialist visit, $400 for an emergency department visit, and that's it. You don't have to worry about, oh, did my emergency department visit just cost $10,000 and now I'm on the hook for 20% of that when I could have just paid $400 flat for that service. So these are important terms to keep in mind. I know I just went over it kind of quickly. As I noted, healthcare.gov has this all laid out. I'm not a government employee, but really shout out to the federal agencies that put this together, because it's a great resource for individuals to kind of have this glossary of terms as they're navigating their own health insurance circumstance. And this is something that can be used even if you're not getting a plan through the marketplace, even if you're trying to decide between your employer plans, just having a handle on this terminology.
Yeah, and you're really trying to predict the future. I think about it like sort of like your cell phone plan, right? Like whether you're going to go unlimited or you're going to cap the data, you're making these assumptions about what your usage is going to be of healthcare. How much are you going to get? How many visits are you going to have? And you don't know. You don't know, the year that I was diagnosed, who knew?
Wow.
And so you're making these
So, well, let me.
Yeah.
Wow, because my mind is, and I'm thinking about, that unexpected gallbladder or that appendix or that whatever, right? So if you haven't met your deductible, then that's a whole different issue. But even if you met your deductible, but you didn't reach the cap on your out of pocket expenses for the year, you are still responsible for some of those things, that breast biopsy, et cetera. But what I did hear you say, Maya, is Dr. Maya, is that the preventive services, those are covered, right? That colonoscopy, that mammogram. Now we can get into whether or not it's 2D versus 3D and whether or not you have to pay a little something out of pocket for those, which I think, Laura, we probably has there been legislation to support and pass that women don't have to pay additional funds for 3D mammography now?
It's based on the state at this point. It can. So let me back up. It depends. Your employer really sets your policy. So if you work for a large employer, they might have different rules than the federal policy or the federal legislation or state. So I know that's an added complication, but
Important to know.
yeah, in most cases in the states, you might have that covered. But we'll ask also Monica when she comes on. She might know and have information about that. But there is a difference between a large employer versus, let's say, a smaller employer, or if you're on one of the healthcare.gov exchange plans.
And I challenge Touch for Life, and as part of that challenge, a challenge accepted on my part, that we're going to put something on blackdoctor.org. We're going to write an article about this. So if you got those terms, but you didn't, if you were trying to write them down furiously, don't worry. There is help coming. We will put the link in the chat, yes, for the government website, but also we're going to break this thing down in an article for you. Dr. Maya, let me ask you also if there's, when we talk about health equity, right, the difference between 2D versus 3D mammography and how having access to those things is an equity issue. Can you weigh in a little bit on some of the insurance related challenges for that disproportionately impact breast cancer survivors and Black women in particular, even in the screening realm? Like, I think of it as an equity issue. If you have to pay extra money to get a 3D mammogram, when 3D mammograms are the Cadillac of breast imaging.
Yeah, Dr. Mo, you are exactly right. And I think that Laura did a really phenomenal job explaining a little bit about where we are in terms of this. And I think one of the things that's important to keep in mind, especially in the cancer space, is how fast cancer screening, treatment, survivorship has moved in terms of extending folks' lives in the last several decades, and especially the last several years. Like in the last 5 years, there has been really a revolution in breast cancer treatment in particular. And so what that means in the insurance landscape is that the insurance companies are still kind of playing catch up and trying to figure out what is efficacious, what works, what should be covered at what level and for who. And so that leads to a lot of confusion for the consumers trying to figure out, is this something they're going to have an added cost for? You see the ads on your TV, you hear about these sorts of additional services that are being developed, but you might run into a hurdle where your insurance may or may not cover it. And so that's kind of the underlying current here, is that the science, fortunately and unfortunately, I think, is moving so quickly that it's a little bit hard for the insurance companies writ large. I mean, this isn't one insurer specifically. I think it's pretty much a nationwide problem where we run into this. And as you noted, it's really foundationally an equity issue, because what that means is if a Black woman hears that these added services that she could really benefit from are not going to be covered, she doesn't get that, because it would mean paying out of pocket, going to a private practice where she can self-pay. And we know that Black folks don't have the same generational wealth as other populations in this country. And so let's talk about the structural issues too. And so when we think about, oh, it's not being able to afford that 3D mammogram because my insurance doesn't cover it, it's why can't someone afford that 3D mammogram? Because insurance doesn't cover it. So these are the sorts of things that I think about when I think about kind of the interplay between where we are scientifically and how that intersects with insurance coverage writ large.
Ooh, and
Yeah.
it brings me to my final point, Laura. I want to ask you about genetic testing, especially in the health equity issues surrounding that, because you have a movement called Black Genes Matters. And I want you to weigh in on what Dr. Maya said, but then also bring us home and talk a little bit about that particular issue as it relates to health equity and insurance coverage.
Yeah, so genetic testing and genomic testing or biomarker testing are very, very important to screening and to treatment. So first, let's talk about risk factors. Knowing your family health history and any kind of what's called mutations that you have, genes that aren't quite working right, that put you at a higher risk for cancer, really are important to us in the Black community. Because of the statistics that we stated earlier on, the gaps, the mortality rate, the diagnosis, we need to have every piece of information we can about what our risks are so that we might need to be screened earlier or more often, again, to catch these things earlier when they're more treatable and curable. And so let me just talk about what the importance of genetic testing being covered. What's important is, particularly from an insurance perspective, is to document your family health history, because that can indicate that you might be at a higher risk. If your first degree relative, mom, dad, brother, sister, grandpa, aunt, uncle, etc., have had ovarian, prostate, breast, pancreatic cancer, that could put you at a higher risk. So it's important that's documented in your medical record so that you can get more likely to be covered by insurance. And then if you've got a diagnosis, if you've been diagnosed with breast cancer, I was talking to some folks on Facebook earlier this week. They have been diagnosed, but none of them, they're Black, none of them had the test to tell what mutations were driving their particular cancer. But that is covered typically. So if it is not in your state, what's important is that there is state-by-state legislation rolling state by state to ensure that genetic and biomarker testing is at no cost to you if you're on a state plan, a Medicaid plan, or one of the state exchange plans. And that right now is only passed in 14 of the 50 states in the United States. And so we have a whole program. If you're interested in advocating, we're trying to train people on how to advocate. But it's not covered nationally. It's state by state, this policy to make sure that the testing is at no cost, because that's one of the barriers, is a potential for it not being covered and to cost you to get these important tests. And just from an equity perspective, it's just so important that we get access to these tests so that we get the latest treatment and that we get the right screening, and cost just shouldn't be a barrier for that.
Wow. So as we close out this segment, it's important for us to sort of recap what we talked about. We went over some of the terms that you should know as you're looking at what policies to choose and understanding the complex landscape of healthcare insurance. We talked about some of the issues in health equity. And the third thing, and the really important thing, is that we talked about knowing that family health history, and not only knowing it, but documenting it, and how important it is to make sure that what we know is measured, is monitored, is written down in our records so that we can qualify for everything that we need to keep ourselves healthy. So if you're just joining us, this is SOS, and it is giveaway time. We got some prizes. We got some great stuff for you. And we invite you to click the QR code, pull out your cell phones and your mobile devices, and we want you to join the SOS community, because yes, today's subject is very heavy and it's important as we talk about health insurance, but guess what? Self-care is not selfish. And every fourth Saturday, we are bringing to you our selfless act of self-care for you as you fill your soul with information on nutrition, information on wellness, information on screening, information on how to live a thriving, healthy life for our Black community. So you're just joining us. This is SOS, and it is my privilege to really bring on our next panelists. And we want to talk about something that impacts our communities, which is pre-existing conditions. And so it's a joy to introduce Monica Bryant, Esquire, who is the Chief Operating Officer of Triage Cancer. She's joining us today, and we want you to put your questions in the chat because this impacts not only your health insurance, but life insurance, but pre-existing conditions. What stuff are you bringing to the table that we need your insurance to cover? And how does that impact things like your premium and your deductible and your plan and your out of pocket and all those terms that Dr. Maya used? So, Monica, welcome. Thank you so much for joining us today.
Thank you so much for having me.
All right. So, as usual, I want you to tell us a little bit about yourself and your background. And if you wouldn't mind, tell us your why so that we can get a sense of how you came to rise to the ranks at Triage Cancer and what that work means to you.
Well, I am a cancer rights attorney and co-founder and chief operating officer for an organization called Triage Cancer. And we're a national nonprofit that's dedicated to providing education on the legal and related practical issues that come up after a cancer diagnosis, both to the people who have been diagnosed and their caregivers. And oftentimes when I tell people I'm a cancer rights attorney, I get a blank stare back and well, what's that? Or what's legal about cancer? And the answer is actually almost everything, from what drugs someone has access to treat the cancer, to what insurance has to cover, to what employers are or aren't allowed to do, to medical decision, finances, and everything in between. And so really my why I have dedicated my legal career to this work is I don't think that people should have worse health outcomes just because they don't have a law degree. Everyone should have access to the same knowledge and information so that they can make educated decisions that are right for them.
I think that is so important. I heard you say that everyone should have access to the same information so that they can make important decisions for their health. And I think you're absolutely right. And that truly is the essence of health equity. And so when we talk about things like pre-existing conditions, right? And I guess, you know what, let's go back and let's talk a little bit about Medicare. We talked about private insurance, and Dr. Maya gave us a lot of great terms to know. But how exactly does Medicare work? And can you explain that for folks who are watching today?
So Medicare is the federal health insurance program available for people who are over the age of 65 or people who have been receiving Social Security disability insurance for 2 or more years, or who have end-stage renal disease or ALS. Those are the only 4 ways to access Medicare in this country. One of the challenges about talking about Medicare, especially in a short period of time, is that it's actually not one thing. Medicare is 4 different things, and people need to understand the differences between each thing. So when we talk about Medicare Part A, that's hospital insurance. And most people who have worked and paid into the system are going to get Part A premium free. So they're not going to pay that monthly premium. Part B is our medical insurance, and that's what actually covers almost everything. So it's going to cover the doctor's visits. It's going to cover those preventative services. It's going to cover mammograms. It's going to cover IV chemotherapy. Even if someone has worked and paid into the system, there is that monthly premium for Part B. And a lot of people are surprised by that, thinking, well, wait a minute, I thought Medicare is going to be free, when in reality there is a monthly premium, and that dollar figure changes year after year. There's also that annual deductible people have to pay in Part B and a 20% coinsurance. So someone is going to pay 20% of all of their bills that are for things that are covered under Part B. There is no out-of-pocket maximum for Part B. Yeah. So if someone, for example, is receiving IV chemotherapy that's covered under Part B, that's expensive. And 20% of expensive is expensive, right? So that is a huge shock for a lot of people. Now, I haven't even talked about prescription drugs because that comes in Part D. And Part D plans are sold by private insurance companies, and that's going to cover your prescription drugs. So someone who has what's called original Medicare has Part A and Part B, and they can go to any doctor around the country that accepts Medicare. You with me?
Still with you. Still with you. I'm waiting to hear about Part C and more about A and B. Go for it.
So we have A for hospital insurance, B for medical insurance, D for prescription drug coverage. That's a lot for someone to probably navigate, potentially 3 different premiums. It's a lot. An alternative can be found in Part C, otherwise known as Medicare Advantage plans. And these are Medicare plans sold by private insurance companies. And they bundle all of the services that you get under Parts A and Parts B. And when I talk about managed care, what I mean is it's going to be an HMO or a PPO. There's going to be a network of providers that you have to stay in. It operates more like the insurance people are familiar with when they get it through their jobs. The tricky part is that when these advantage plans are advertised, and if you've watched any TV in the last couple of weeks, you've probably seen some commercials that say things like, get your free Medicare plan. What they are selling are Medicare Advantage plans. And it's actually it's a lot misleading because they're not actually free. You still have to pay at least your Part B monthly premium. What they are saying is that you're just not being charged anything above that, and you may get some other services in your Advantage plan. So one of the most difficult things for people to kind of discern when they're making their Medicare choices is what lane are they going to drive in? And we use this lane analogy a lot at Triage Cancer. So lane 1 is where you get each part separately. So you get Part A for your hospital insurance, Part B for your medical insurance, and you pick up Part D for your prescription drugs. Lane 2 is Medicare Advantage, where you're bundling everything in one plan, but you're going to be limited by that network of providers. That comes up in a significant way because people think, oh, it's more affordable for me to buy a Part C plan, and I get these added benefits, like maybe I'm getting dental coverage too. But then they get diagnosed with cancer. And they want to go see the specialist, or they want to go see the world-renowned surgeon, and they find out that provider they want to see isn't in the Advantage Plans network. So,
whoa.
Did you have
Go
something,
ahead,
Dr.
keep
Mo?
going, because I'm with you. I got a question for you, because now what I'm hearing is that when everybody's like, oh, go get a second opinion, get that other opinion, it sounds like to me there's some health inequity, right, in who you can see and what doctors you even have to choose from. But keep going. This is fascinating.
Absolutely. And so if someone is in a situation where they're thinking, wait a minute, I want to be able to have the most amount of flexibility in the providers that I'm going to go see, but I also want to protect myself from those, or the lack of out-of-pocket maximum in Parts A and Parts B, there's something they can do to protect themselves. And that's to drive in lane 1 with original Medicare, and then purchase an additional type of plan called a Medigap plan, also sometimes called a supplemental plan. So as if this wasn't confusing enough, we're going to have multiple names for exactly the same things just to, make it harder for people. Those Medigap plans are identified by letters A through N. So we have parts, Medicare parts A through D, and Medigap plans A through N. We're just layering on the complexity here. But the benefit of these Medigap plans
is anybody else meta confused?
Right? So the benefit of the Medigap plans is that they're going to pick up those out-of-pocket expenses in Parts A and B. And so sometimes people will say to me, well, wait a minute, you want me to save money by spending money? And the answer is maybe. So someone actually has to do the math. And we have a number of resources, including a 90-minute webinar recorded on our website that people can watch to learn more about this, because I know I went through it quickly. We have worksheets that people can fill out to try to compare their costs between different plans. But the main thing I think I want people to walk away with today is that they really have to make educated decisions now, because we're in open enrollment now, because those decisions can certainly be impactful for certainly the year ahead, but potentially many, many years ahead.
Wow. So if you're just joining us, this is SOS, Soul Filling Our Sisters. And boy, oh boy, have we got our ears and our souls full of knowledge about Medicare and the different options and the different plans. We did have a question in the chat about the difference between Medicare and Medicaid. Could you speak to that briefly?
So I mentioned that Medicare is the federal health insurance program for individuals over the age of 65 or people who have been receiving SSDI for 2 or more years. Medicaid is the other federal health insurance program that's available to individuals with lower incomes and in some situations, lower assets. The reason it is challenging to talk about Medicaid succinctly is because while it's a federal program, it's a partnership between the states as well. So every state has a potentially slightly different Medicaid program. And even within the different states, there are a couple of different doors someone can walk through to access the Medicaid program. So, for example, for someone who's been diagnosed with cancer and has been deemed to be disabled by the Social Security Administration, there's a door someone can walk through. But that door doesn't just look at income, it also looks at someone's assets. So that's like a savings account with more than $2,000 or a retirement account. And if someone has more than $2,000, they're not going to be eligible to walk through that door. We've talked about the Patient Protection and Affordable Care Act, otherwise known as Obamacare, earlier. And one of the wonderful things that that law did was it created a fifth door to walk through into the Medicaid program. And that door is just based on having a lower income. That fifth door was supposed to exist in all 50 states. The Supreme Court basically muddied the waters and made it voluntary. So we're now in a situation where we have 39 states in DC that have expanded, have created that fifth door to walk through, and 11 that have not yet expanded their programs. So little tricky to talk about it again, because it is so state specific, but on triagecancer.org, we have multiple charts of state laws where you can actually look to see what's available in your state.
Wow. And so this is why it's so important for us to pay attention, right? Before you need that insurance, pay attention to the plans, pay attention to the options, read the fine print. And I heard you say, Monica, something like, beware of predatory advertising, beware of things that can be misleading about what plan you select, and to really do the homework. And so the last question I have for you is about resources that you have. How do people navigate this? And you know, where can they go to better understand their options? Could you just really 30 seconds and give us the highlights on how a confused audience can sort through all of this?
So at triagecancer.org, we have a multitude of different materials and resources. We have recorded webinars and animated videos. I mentioned some worksheets and checklists, but we also have a legal and financial navigation program where someone can receive one-on-one assistance. You fill out a form on our website and you will get an email to schedule a call with us. And we get on the phone with you and we answer your questions. So we, don't provide legal representation, but really most of the time people just need accurate, reliable information to make the right decisions for them and their families. And that's really at the core of what Triage Cancer is trying to do.
Thank you for that. And, as we go into our next segment, I want you to take this to heart. Where you live, right? What state you live in, what coverage you have, shouldn't determine whether or not you actually live or die. Think about this. We'll move to the next segment. And as we move into our next segment, Laura, I want you to talk to us a bit about the Behave program and give us some good news. Give us some hope. Tell us what's on the horizon for us.
Yeah, so we talked, when Monica talked about, state by state, there are, again, laws state by state that can help in many ways from a coverage perspective. And so what we're doing is we've launched what's called Behave. It stands for Breast Health Advocate Voices for Equity. And really it is for allies and Black and brown folks who've been impacted by cancer, breast cancer, who are really interested in learning how to ask their representatives to support policies that impact our community. In particular, we're focusing on, I mentioned the biomarker and genetic testing legislation that makes that no cost. Again, it's only in 14 states and we need it to be in all 50 states. There's also legislation about, you talked about the 3D mammogram, also other screening, ultrasound, MRI that are really important in detecting breast cancer, particularly in dense breasts, which Black women tend to have at a higher rate. And there's legislation to make that type of screening no cost as well. But what we're doing is we've got a 6-module class that'll train you how to tell your story, what's the legislative process, how do you reach out to your legislator, how do you read legislation. We've got experts coming in to train our community. We're starting in the state of Maryland, and you could sign up using this QR code that's on your screen. The application is open until December 1st. Please apply. Please tell your friends and family. We would love to have you in our cohort and help you tell your story. And it really came out of my own experience of being tokenized by a large, well-known breast cancer organization that kind of made me feel uncomfortable about asking questions about the legislation and whether the legislation was good for the community that Touch for Life represents. You guys, the Black and brown community. And I didn't want anyone to feel like that ever. And so we created Behave to empower our community to have a voice.
Wow. So I hear you saying that people can actually, if you're watching and if you're just joining us, this is S.O.S, Soul Filling Our Sisters. We're talking about the heavy topic of insurance, healthcare coverage, especially as it relates to cancer, but what you need to know in order to make sure that you have all of the preventive care that you need. And in doing so, you can't talk about health care and not talk about health equity, or rather health inequity. And we've been talking about what's not so equitable in healthcare today. And part of that really has to do with genetic testing, genomic testing, mammograms, the type of mammograms, where you get your care, what doctors you can see. And Laura shared with us the Behave program, where if you're watching and wondering, how can I get involved? And where do I start? And well, what can I do in my community? There's an opportunity for you to engage and get involved. So we'll show that again at the end. Thank you for sharing that. And as I bring all the panelists back up, we got to talk a little bit more about, when a diagnosis happens. There's some things that we do. As a surgeon, I talk to patients about genetic testing. We talk about tumor types and chemotherapy and what treatments you'll need. And so what should people look for as they try to figure out if they have the right insurance for breast cancer treatment and care? And Dr. Maya, I think I'll start with you, and then we can round robin and everybody else can fill in anything that's left out. But what is it that people should look for in their policies?
Great. Thank you so much, Dr. Mo, for that question. First, just want to acknowledge that a cancer diagnosis is very scary. So your initial inclination might not necessarily be to go and look at what your plan covers and doesn't. I just want to name that it's very overwhelming and you have a lot going on at once to start. But something that's particularly important in the context of cancer that we touched on very briefly today is the idea of in-network versus out-of-network. And so if you want to be seen at a particular hospital facility or even see particular cancer specialists, that I think is probably one of the number one things that someone with a new diagnosis of cancer should go and look at in their plan, above and beyond all of those terms that I just mentioned. Whether the folks that you want to see are in network and out of network, and who it is in network, can have very deeply meaningful consequences for how much you will end up paying out of pocket. And so that is the first piece that I really want to emphasize, because as was alluded to, when we talk about, get a second opinion and things like that, depending on your type of plan or the networks in your plan, those sorts of options may be very limited. And so you want to know ahead of time, before you get a bill that you weren't expecting, that you accidentally saw someone who is out of network. And so for folks with a new cancer diagnosis, I think that's number one thing, is to understand what hospital, healthcare systems are in your insurance networks and what specific providers are in those insurance networks, to make sure that you can see the folks that you want to see and have that agency over your healthcare.
I think that's super important. Also,
Laura, I think you're weighing in. Do you have something else to add?
Yes. I would add also what drugs are, I'm going to use this term, on your formulary. Basically, it's the equivalent of in-network and out-of-network for prescription drugs. So if you're taking a particular drug, then it's important to make sure that that is covered by your plan. And that's something that when it's open enrollment, you can call the company and ask these types of questions. Is XYZ prescription drug covered, and at what cost? Because they can be, the same drug can cost something different depending on the plan that you're on.
So I definitely agree with both of those things. And I would just add two other things. The first is, I think we have to remember that even if someone currently has a plan that isn't meeting their needs, so they're not able to see the doctors they want to see, or it doesn't cover the drugs that they want to cover, we get to make different choices every single year, even with a diagnosis of cancer or some other type of pre-existing condition. That is the amazing thing that the ACA or Obamacare did for us as a healthcare community, is it gave people the freedom and the flexibility to make changes each year to make sure that the plan they're picking meets their current needs. So I think that's the first piece. I think the other piece that I want to make sure we leave people with is, if they're in a situation where treatment has been denied by their health insurance, or a drug has been denied, that as consumers, we have the right, with every type of health insurance we've discussed tonight, we have the right to appeal those denials. And so I just want people to know that the process might be different depending on the type of insurance somebody has, but that you don't have to take no for an answer.
And I think the other thing to mention is, I talked about it before, but, ask the questions. If there are questions you have that have come up, like that we're talking about, hey, are these tests covered? Are these drugs covered? Can I get a second opinion? Ask now while it's open enrollment so you can get the answers to these questions, because each insurance has rules and policies, and you'll want to understand that before you're in the midst. But if you are, you still have the right to ask these questions, and there are things like appeals as well.
Wow. I think that's really powerful information to know that, one, a delay is not a denial, and even a denial can be appealed. But if you're watching, we're talking about insurance, and we're helping people to understand what it is that they need to know as you navigate this complex landscape. And if you're, battling cancer, the one thing I want you to know is I want you to talk to your cancer center or your program about whether or not there are financial navigational services available. One of the really new and interesting things that we're starting to do in cancer care is we are starting to have folks to help people navigate the financial landscape of cancer, and it's specialized training. ACCC has a lot of resources available, and you need to find yourself a financial navigator and get in the know. If you need additional resources, Triage Cancer is there for you. Touch for Life is there for you. And, I want people to feel empowered as we end this conversation, knowing that there is some hope. And so keep putting your questions in the chat. We're still here to answer those questions. As we get ready to close out, we want to make sure that we give you the scoop on what's going on and what you need to know, and then what we're doing next month for SOS. So stay tuned. And we're getting ready to wrap up Soul Filling Our Sisters. We've had a riveting conversation about health insurance today. And as we get ready to close out, I would love to have each of you really give your key takeaways. What should people know when they talk about this program? What should they share, and what should they do for themselves coming into Monday morning? Because it's Saturday and Monday will soon be here. But what should they know? What should they do? What should they share? I'll start with you, Dr. Maya. We'll go to Monica, and Laura, you can take up the rear and give us everything we need to know.
What you should know, I encourage all of you, since it's open enrollment season, know these various terms. Know what your premium is, know what your copayment is, know your co-insurance if you have one, and understand what it is you're signing up for. And if you realize that it's not something that's working for you, look at what your alternative options are. And as was noted, there are a whole host of options. If you forget the terms that we talked about today, there's healthcare.gov, as well as a wide variety of resources that we'll share that you can keep this fresh in your mind. So keep that glossary side by side with your plan, understand what you're signing up for. And if you're like, hey, you know what, maybe I actually don't want co-insurance, see what options you have to potentially switch.
I would say know that if you find all of this confusing, you are not alone. We often say that there should be a class in high school on health insurance and finances, because we all have to figure this out, but few of us are ever really taught. So it is confusing, but also know that you're not alone in that there are organizations and people out there that can support you in making these choices and navigating the health insurance policies once you have them. So financial navigators, social workers, community health workers, Triage Cancer, healthcare.gov, these are all places that you can go to get support as you try to navigate your various choices and using the health insurance once you have them.
And I would say just make a list of questions that you have. Think about your last experience and what was frustrating about it. when trying to use your health insurance, make a list of those questions and ask about the different plans and what they provide, and can they answer your questions, particularly around the testing, genetic and biomarker testing, and your prescription drugs. Just ask the questions so that you at least are making a better informed decision about what plan is best for you. And I think with that, oh great, we're going to bring up Behave. Just want to make sure that you have the opportunity to sign up, tell your friends, tell your family. It's a really fantastic program that we have created to teach us how to advocate for the policies that really cover the things that are important to us. So that's great. I think with that, we are going to say thank you very much for joining us today. We have the same time next month. We're going to be focusing on talking about questions with your provider. And so please join us next month. Please join our community. And thank you so much for spending time with us today.